still enjoy taking care of patients. I still am able to see patients a day a week, even during the campaign. But I can tell you that I am deeply concerned about the direction of Missouri with this administration. I have people who, my patients come into my office, they stack their prescription bottles across my desk and ask me which ones they can get rid of because they can't afford them anymore. I don't want to see our seniors in Missouri choosing between prescriptions, utility bills, and food. That's not the value system that I grew up with in southern Missouri, and I don't think that represents our values by any means. Now, the Lieutenant Governor position is particularly attractive to me because the Lieutenant Governor is by statute the chief advocate for seniors in Missouri. I don't know anything more important to seniors than access to affordable health care. And that's where the Lieutenant Governor should be. For example, if the Governor has a plan to cut 400,000 folks off of health insurance, we would expect the Lieutenant Governor to stand up and say, that's wrong, you can't do that, that's going to hurt people. As my job as senior advocate, I won't let you do that. I'm going to build public support to stop you. And that didn't happen in Missouri. Now, we have someone running for governor, Jay Nixon, who we all expect to win. He has a large lead in the polls, and I want to be there to help him restore the Medicaid cuts and lower the uninsured in Missouri and come up with some innovative ways that we can move forward as a state to get more people covered with health care. The Lieutenant Governor also is responsible for a dozen boards and commissions. Half of them have something to do with health care, which is my background and my education and training. So we have a chance to change direction in Missouri. We have a chance to change the priorities of state government, and we can do that. We can do that without a tax increase. We have some in the legislature who believe that we now have an $800 million surplus. If that's true, we know exactly where it came from. It was built on the backs of the people who lost their health insurance. Kids, seniors, and people with disabilities, and that's wrong. My name's Sam Page. I'm running for Lieutenant Governor. I'd love to have your vote, and I look forward to working with you over the next 4 years. Thank you.
Governor Wilson, why did you wait until 8 days before the primary to finally cast an endorsement in this race?
I'd actually endorsed Sam before that. It's probably been up on the website for quite a while. Some people might not have noticed that it might have made a difference with. We thought it'd be a good idea to go ahead and make sure that got a little additional public service. And I want to thank you for being here.
How do you restore the Medicaid cuts budgetarily? What sort of things would you forego in order to keep the budget balanced in order to pursue that goal?
Well, we know that we have built up a surplus. We just don't know how much. It takes $265 million of state general revenue to restore those cuts. That's within our budget to do that. The first thing I would look at is a $95 million tax credit given to one person in St. Louis County, one developer. Those aren't the priorities. Restore the Medicaid cuts for people with disabilities, our seniors and our kids, or give one tax credit to one developer. That's an example of misguided priorities over the past 4 years.
How did you vote on that bill?
I voted for the whole economic development bill. I voted for the amendment to strip that out.
Okay. Some Republican critics will say, well, you might have enough money to do it this year, but you might not have the money to do it in subsequent years. How do you respond to that?
We can't afford not to do it. Mm-hmm. We're paying $500 million out of general revenue just to pay for uncompensated care in Missouri. We're going to pay for this one way or the other. We're already paying for 60% of Jay Nixon's budget. We're already paying for 60% of his plan to restore the health care budgets in our taxes that go to Washington. Our federal taxes are going to pay for 60% of his plan. The money's already there. And it's being diverted to other states that have different priorities, more mainstream priorities in access to health care. So what we're trying to talk about is whether or not we're going to make that initial investment of $265 million to restore those cuts and draw down another $400 million in federal matching fund and stop this bloodletting of the uninsured.
Those cuts were made to impress Washington, D.C.
How so?
We had somebody thought they might be vice presidential timber. They wanted to show that they could be tough on budget cutting. And financially, it's a disaster when you get 40 cents for every 60 cents we spend for health care. Like Sam said, that's unconscionable. Besides that, that money simply stayed in the program and went to other states. Other states got better health care on the backs of Missourians.
That's right. Okay, thank you. Thanks for coming out.